It's Dr. Charschan here. I'm going to show you a couple of hip capsule stretches that are in addition or are modifications than the ones we typically teach. These hip capsule stretches will address certain situations that are a little bit less common. One of the restrictions that a lot of people experience are with the hip up, they can't bring the leg in. So I've developed a stretch that you don't typically see for the capsule that actually addresses that. And the way you do it is you get on one knee just like this. And then you bring the leg forward, and you want to feel that stretch as you do it in here. And now what you do is, in order to be able to get at it, what you're going to do is you're going to bring that knee in. And as you do this, and you can lean on a wall or something like this, you're going to actually feel a strain. Now don't push too hard, because we don't want to put a strain on the sacroiliac joint. We just want to go ahead and get the capsule, which is the tissue that surrounds the joint, to open up a little bit better and move in a healthier fashion, thereby keeping the joint healthier. And then what you do is you take your arm, bring the arm all the way up, and as we lean into it, we can actually feel the joint opening up a bit. Now you may even feel a couple of releases as you're doing it, and you can use this front leg, move it over a little bit, and you get even more stretch into it. And be patient. It could take a minute, 2 minutes, 3 minutes for this thing to fully open up. And you do it daily, you're going to notice that that range of motion is going to improve markedly. If you're a runner, this is an area that tightens up a lot of times on runners. So when you're having chronic IT band issues, which is the lateral side of the leg, it may not be IT band at all. It could actually be just tightness in the joint capsule, and that's actually tightening up the leg. And if you're getting frustrated because some of the things that you typically are told to do by running magazines and such don't really work, that could be the reason why. So you'll notice as we're doing this, I keep on moving the leg in, I keep on getting more of a stretch into it as I'm allowed to, and I'm able to bring the arm up a little higher, and I'm able to go up a little bit easier. Now it's very important to go ahead and keep the body as straight as you can, because if you do not do that, you're taking the stretch out of the hip. This particular exercise is one that you would do if you're having restrictions in hip flexion. So hip flexion is this particular motion in here. And let's say I were to tell you that you're restricted in flexion. I'll instruct you to do this particular exercise, and this particular exercise is kind of unique in that a lot of times people won't ordinarily do this one because they don't realize that this is restricted, but here's how you do it. So normally, if you feel that I'm working on it and I'm stretching this thing forward and it's really restricted and it takes a while, you can do the same thing at home by just putting your knee up like this. Put it on your bed, put it on a table, put it on a chair, whatever you want to do, as long as it's a stable surface. And then what you can do is you're going to lean forward while letting the back knee bend a little bit. And then as you're doing this, you're going to continue to bend forward. Now don't press too hard or too fast, because we don't want to upset the sacroiliac joint. We just want to go ahead and actually get to the hip capsule, and this will give us a lot of authority on that hip capsule, where we can actually go ahead and reinvigorate or re-improve the flexibility that we've lost in there that we didn't realize that was happening. And you can sit there for a minute, minute and a half, and then you'll finally start to feel it let go, and then you continue to stretch it. This is a modification of the hip capsule stretch in our previous video, where we're showing how to go ahead and stretch it into internal rotation. Internal rotation is the hip actually not having the motion to turn inside. So originally we showed how to go ahead and do this laying on your back and stretching it in that direction. It's kind of awkward. It works okay, but here's a much better way to get leverage on it. So what you can do is you can put your foot up on a bed, or you can put your foot up on the edge of the bed, depends on your height, or you can put your foot up on a stair. And when you do this, you're going to put your foot, you're going to turn the foot out, and as you're doing this, you're going to rotate away from it. Now as you're doing this, you're going to feel a little bit of strain. Don't push too hard or too fast, and the reason is because we don't want to screw up the sacroiliac joint. What we want to do is we want to get much more range of motion into the hip. And as we're doing this, you'll notice I'm turning the left foot out, and you'll notice I'm rotating in, and then I'm turning the right foot out a little bit too. That increases the amount of rotation that we get on the hip. And again, don't go too hard or too fast. And as you stretch it, you'll start to feel maybe some releases, and you'll start to notice, hey, I can go a little farther, a little farther, a little farther. And doing this on a daily basis, when you have tight hip capsules, will eventually open the hip capsule up. Now, if you do have problems in the hip, or the hip is a little arthritic, you may get to a point where it will not go any farther. Then you've reached the anatomical limit. At that particular point, that's as far as you should go, because quite honestly, there is going to be a physiological restriction. However, if you're an older person who's got arthritic hips, you may find these maneuvers to be very, very helpful in maintaining the quality of how the hips currently work. And if you're the type of person that wants to avoid hip capsule surgery or avoid having a hip replacement, which is offered to a lot of people, this is a great way of maintaining the health of the hip as it is.